Hormone replacement therapy for women is not a new topic. However, inaccurate information and misunderstanding continues to be prevalent when we talk about this topic. Today, Dr. Eileen Palace is back to help us accurately understand HRT and its benefits and risks for women. Thank you so much for being with us. Good morning. Yeah, and we need to have this conversation because there was a big clinical trial that you say the findings of it were really misunderstood.
Yeah, we talked about this once before on this segment, but you're right. The misunderstanding is prevalent not only among women, but among their doctors as well. And what I want to talk about is what the real data is so that women start being able to have necessary treatment so they can get better. There was a study started back in 2002 called the Women's Health Initiative, and it was terribly misunderstood. Even the author said that people misunderstood it.
Wow.
It claimed that taking hormone replacement therapy, and they only used 2 types of oral pills, that it caused increased heart attack, stroke, breast cancer, and blood clots. The fact is this is not true at all. There was many problems with the study. We won't go over all of them, but one of the main ones was they used 60 and 70-year-old women who were already a decade past menopause and probably entered the study with cardiovascular problems before they took the medication. So the medication had nothing to do with it.
Gotcha. Okay, so what are the effects of menopause that this is trying to help with?
When you go through menopause, you're going to have ovarian failure, which means you're going to have a decrease in estrogen. Estrogen is vital for most of our functions. Mother Nature is very mean to us when we go when we're no longer reproductive available. She figures we can shut down the rest of our systems as well. So the most common symptoms you're going to see are night sweats and hot flashes, which you hear women talk about all the time. Urogenital decline, which means you're going to have more likely bladder infections, vaginal atrophy, which is a thinning of the vaginal wall, which makes intercourse painful, sleep disturbance, memory loss, backache and back pain.
It's just none of it's good. Okay, none of it's good at all. Okay, so let's talk about some of the statistics for estrogen-only therapy.
Well, I'm going to read this to you because they're really impressive. This is a new study that came out, and they found that 40% reduction in coronary heart disease when you're using estrogen, 11% decrease in stroke, 12% decrease in diabetes, 30% decrease in fractures, that's because of osteoporosis, a 65% decrease in Alzheimer's, 20% decrease in colon cancer, 33% decrease in breast cancer, so contrary to that study, and a 40% decrease in mortality. So I think that's rather impressive. That's from taking just estrogen alone therapy. The authors concluded that avoiding hormone replacement resulted in the premature deaths of 18,601 to 91,610 women after the release of that study.
Wow, almost 90,000 women. So,
huge difference.
Then what are the treatment options if you are considering
There's many options now, and orals are the least effective, so I really don't recommend taking the oral method.
And that's what the study looked at?
That's what the study, and only 2 types of that, yes. There are vaginal creams that you can take, there are gels, there are patches, there are monthly injectables that you can use, there are sprays, and one of the newest things which is really neat, there are bioidentical hormone pellets that you actually have implanted, and they last for 6 months straight, so they keep your hormone levels stable. The FDA has not approved those in the United States, of course. They approved it in Europe and many other countries, but they've not approved them in the U.S., but women can get them. It's just that you have to pay out of pocket. Okay,
so for women who were confused by the findings of that study and are still kind of leery about taking this, what do you say in general? Take them?
Yes, I just read you the data on the number of things, everything from Alzheimer's to mortality that the hormone replacement helps you save. Bottom line is going to be start now. When you're premenopausal, go get your free testosterone, your estrogen, your FSH, and your total testosterone to find out what your baseline is, because once you're postmenopausal, you won't know where you're trying to, you'll see it drop, but you don't know what your aim is. So you want to get your baseline so you can tell this is not a one-size-fits-all kind of a thing. Then make sure that you listen to your symptoms. How are you getting physical symptoms? How are you feeling as well? Don't just go by numbers. Go by what your own subjective feelings are and what kind of symptoms you're having.
All right, well,
and make
thank
sure
you for
that
trying to clear up this topic in such a short amount of time. I do want to give you a chance to say you are seeing patients again.
Oh yeah, thanks. I have been doing research for many, many years, but I'm actually just reopened my private practice and I'm taking patients full time now.
Great. Well, I'm sure the phones will start ringing again. Thank you so much for being here, Dr. Palace.